Mr. President,
Senator from West Virginia.
first of all, I want to thank my good senator from Oklahoma, Senator Inhofe, on his leadership on this very, very important piece of legislation. I'm proud to be part of that with you, sir, and the leadership you've shown for us fellow pilots, and basically the only connection we have in some rural parts of not only West Virginia but all over the country is our private aviation. We hope to keep that alive and well, and I know in your state, Mr. President, the same, and we appreciate all the support, and we appreciate your leadership, sir. Mr. President, I rise today to speak about a very important issue that I believe will truly help each and every one of us, every senator and every congressman from all 50 states, accomplish something meaningful when it comes to fighting the prescription drug abuse epidemic that is plaguing communities all over this great nation. Mr. President, I have not talked to a person in my state that has not been affected through a person in their immediate family or extended family with prescription drug overuse. And it's something that is epidemic proportion that we have to fight and work together. Less than a month ago, I was so proud when the Senate came together to unanimously support an amendment I offered with Senators Mark Kirk, our dear friend, Kirsten Gillibrand, Chuck Schumer, and Jay Rockefeller, that would make it far more difficult to abuse addictive pain medication by reclassifying drugs containing hydrocodone as Schedule II substance. Let me explain what this means. In practical terms, moving hydrocodone to a Schedule II drug means that patients would need an original prescription to get their pills refilled. Pills would be stored and transported more securely, and traffickers would be subject to increased fines and penalties. As we speak, negotiations are ongoing between the House and the Senate on a compromise version of the Prescription Drug User Fee Act. The Senate version contains my amendment, and the House version does not. So we're fighting as hard as we can to make sure this amendment is included into the final bill. Last month, I stood here on the Senate floor and shared stories that I heard in communities across West Virginia about why this amendment is so urgently needed. Prescription drug abuse is responsible for about 75% of the drug-related deaths in the United States and 90% in my home state of West Virginia. According to the White House Office of National Drug Control Policy, prescription drug abuse is the fastest growing drug problem in the United States, and it's claiming the lives of thousands of Americans every year. But no statistic can illustrate the scope of this problem like hearing the pleas of children who are begging their leaders to do something to get drugs out of their communities. Children like those I met in Wyoming County, West Virginia last October, where more than 120 people have died from drug overdoses in the past 7 years, including 41 last year and 12 already this year. Mr. President, since that proud moment when the Senate unanimously passed my hydrocodone rescheduling amendment, it has come under fire, as you can imagine, from groups who seem to think that trying to limit the number of hydrocodone pills making their way into our communities and oftentimes into the wrong hands is a bad idea because it affects their bottom lines. Now, I recognize that this amendment does not fit into the business model of selling as many pills as possible. I understand that. But with that being said, I believe we have a responsibility to this great nation, and especially to the youth of America. This will affect us for generations to come, sir. To win this war on prescription drugs needs to happen now. And it is one of the most abused substances. Hydrocodone is one of the most abused substances we have and the most addictive. I don't think I've talked to a person who does not recognize that each and every state is experiencing these horrible problems with this prescription drug abuse. And the facts will bear this out. According to a report issued by the Centers for Disease Control in November, the death toll from overdoses of prescription painkillers has more than tripled in the past decade. The finding shows that more than 40 people die every day from overdoses involving narcotic pain relievers like hydrocodone, methadone, oxycodone, and oxymorphone. These prescriptions, painkillers, are responsible for more deaths than heroin and cocaine combined. Yet still we are hearing from some folks who just don't believe that rescheduling hydrocodone is a good idea. And I have said to these groups, let's work together on a compromise that can address your legitimate concerns. If anyone has a concern with this amendment, just come to me, and we'll sit down with you and try to work through it in the most reasonable manner. We've already offered a number of compromises to different groups in an effort to get this bill passed and signed into law. I want to clarify some of these concerns. We've heard from some with concerns that making hydrocodone a Schedule II drug would mean that patients with legitimate need for these medications would face increased hurdles to obtaining them, and that those patients would have to visit the doctor more often. To them, I would say the following. Look at what the DEA did in 2007 to reduce burdens facing patients when it comes to refills. They finalized a new rule allowing doctors to provide individual patients with a 90-day supply of any Schedule II medication by issuing 3 separate prescriptions, 1 for an immediate supply and 2 additional prescriptions that cannot be filled until a certain specified date. If they receive a 90-day supply, patients would only need to visit their doctors 4 times per year. And if they have a chronic ailment, I would think that those patients would want that type of evaluation anyway. That makes all the sense in the world to me, and I know to a lot of Americans. If a practitioner is prescribing medication as part of a usual course of professional practice and for a legitimate medical reason, there is no numerical limitation on the quantity they can prescribe. Federal law does not limit physicians to providing only a 30-day supply of medication. The amount prescribed and length of treatment is within each doctor's discretion. We've also heard from those who are worried that pharmacies could face increased operating costs caused by new storage requirements, as well as increased paperwork. But there is no difference in federal storage requirements between Schedule III and Schedule II drugs. Federal law requires that all controlled substances be stored in securely locked, substantially constructed cabinets. As for more paperwork, pharmacies are already doing paperwork on their current Schedule II drug orders. All this amendment would require is including an additional line on the existing form that specifies how many hydrocodone combination pills they are ordering. The bottom line is we have to recognize that this is a very, very addictive drug. As a Schedule III drug, hydrocodone is very available to people who might not use it for the right purposes, but for illicit purposes. All we are saying is give us a chance to protect some of the most vulnerable people that we have, especially our young people, who are addicted to these prescription drugs. Look at all the people who support this amendment, Mr. President. The folks who are out there on the front lines trying to keep our society safe and fight the war on drugs so that we can all be in a better society and more protected. We have groups like the Fraternal Order of Police, the National District Attorneys Association, the National Narcotics Officers Association Coalition, the National Troopers Coalition, the National American Society of Addictive Medicine, the National Association of Drug and Alcohol Interventionists, the West Virginia Medical Professionals Health Program, the Drug-Free America Foundation, Inc., the National Coalition Against Prescription Drug Abuse, and the Prevention Partnership. These people are on the front lines, and they're saying this amendment is needed, and that will help them immensely fight this war on drug. These are the people who are out there helping us every day in society. We're willing to sit down and work with people if they have legitimate concerns. But if your concern is that this amendment interrupts your business plan, I would hope you would rise above your business plan and be an American first. What we are trying to do is good for this country. It's good for each one of our states. Now, I know it would be good for the state of West Virginia and, Mr. President, the state of Vermont. For generations to come, that we will be working hard and we will be protecting them for the quality of life of as Americans. I'm not trying to put anyone out of business. I'm a business person myself, and I appreciate the hard work of businesses all across this country and the risk they take and the dedication they have. But when you have a problem, you've got to fix it. And we have got a problem, sir. And this amendment is not going to solve all of our problems. We recognize that. And it's not going to eliminate prescription drug abuse once and for all. But it does give us one more tool to fight the drug abuse problem that we have in this country. And to get this passed, it's going to take the voices of the public, not just the voices in this chamber or across the Capitol, but the voice of the public, the voices of people who have seen what is done to our families, to our children, and our communities. We need their voices saying, we can't stand by and watch this happen any longer. Voices like those from Oceana Middle School in my state, it's Wyoming County in the state of West Virginia, who participated in a letter-writing campaign to their elected leaders, asking for help with a drug epidemic. One of them wrote to me, "My town, Oceana, has an issue about drugs. I write this letter to you because I hope you can do something about it. In 2006, my grandmother died of an overdose. She was the only person I could talk to. Drugs make people act in bad ways, and if something doesn't happen about them, then our town will be in worse shape." Mr. President, I've been there many times. I was there as a young person in college. My roommate was from Oceana, one of the most beautiful little cities I'd ever attended. I came back 40 years later. You wouldn't recognize it. You would not recognize it, what has happened. And these are young, 10, 11, 12, 13-year-old middle school children crying out for help. They know what's happened to their families. They're afraid to go out in their own streets. They need help. And this is happening all over America. These students, they want a better life for their parents. They want a better life for their siblings. They want a better life for their friends. They want a better life for their community. And also they want a better life for themselves. They're willing to fight, and we should be willing to fight for them. That is our job, and that's what we were sent here to do. Mr. President, I yield the floor and notice the absence of quorum. I'm sorry. I yield the floor, Mr. President.
Mr. President.
Senator from Rhode Island.
Mr. President,